It is Wellness Wednesday, and today we are talking about different types of cancer treatments. In this sponsored segment, we welcome Dr. Hesham Gayar, Medical Director of the MY-PROTON Therapy Center, to talk about proton therapy versus traditional radiation. Good morning to you.
Good morning.
Yeah, thank you for coming in. So let's talk about this. Proton therapy, a form of radiation. Can you explain how it is different from traditional radiation therapy?
By all means. Proton therapy is a subatomic particle instead of a wave like X-rays that goes through the body. This is a subatomic particle that really stops at the target, being the cancer, and it doesn't go through. So it has the advantage of sparing normal tissue, the unnecessary radiation, reducing the side effects, improving the quality of life after treatments, and making it easier for the patient to tolerate.
Yeah,
and this is a standard form of treatment.
Yeah, so expand on that. You know, what are the benefits for patients using protons versus that traditional X-ray therapy? You kind of touched on that, but it sounds more targeted.
Absolutely. It's the precision and the fact that it's also biologically more active. So it kills the cancer while in the same time it protects normal tissue around it. So anytime you have a critical organ and you're treating with radiation, you don't have to have the sickness and the side effects. Even if chemotherapy is required, you tolerate it better. You can finish the treatment in time, less side effects as you go through, and better quality of life afterwards. That's the main advantage. Yeah,
that's definitely a positive there. And with that said, you know, are there specific cancers that can be treated with proton therapy?
Absolutely. Anytime there is a tumor and sensitive organ next to it, there is advantage to proton therapy. I'll give you examples. Breast cancer, especially on the left side where the heart is close by. Prostate cancer next to the rectum. Lung cancer, esophagus cancer close to the heart. You spare the heart and you still deliver the treatment effectively. And any tumor in the head and neck area, the brain, the pancreas, the liver cancers are very sensitive and can be spared. Normal liver tissue doesn't get damaged from proton therapy.
And how does someone go about finding out whether they are a candidate for proton therapy?
Very easy. You can simply call us. You can call the cancer center, the Proton, or look up the website at karmanos.org/proton therapy, and we'll be glad to explain and even have a remote consultation and see if you're a candidate or not. Anytime there's indication of radiation in your treatment, this is a standard treatment that covers the same effects, superior and less side effects, and it's covered by insurance.
That is good to hear. Now, if your physician does not recommend proton therapy, could you still be a candidate and still get a consultation?
That is true, because many physicians don't know about it or don't promote it because they don't have it. So if you have a cancer and radiation is indicated, call us or reach through the web and email, and we'll respond to you. We'll study your case. If you are a candidate, we'll communicate further with you and study your case in particular, more depth, make a recommendation, and carry on with treatment.
Yes, and bottom line, it sounds like you're happy that this has a less severe impact on your patients.
There is only 2 units in Michigan. There is only 43 in the country, and we are happy to have this for our patients in Flint.
Well, you can learn more from the Karmanos Cancer Institute and the MY-PROTON Therapy Center by calling that number that you see there on your screen. There's a website as well, and we do appreciate your expertise and insight this morning.
Thank you very much for inviting me. My pleasure.
Yeah, it's great to see you.